recording in the cloud. I'm going to start sharing my screen. Hold on one second. All right. Are folks seeing the deck? Someone give me a thumbs up. Thank you. Then let's go to present mode. Present. There we go. All right. Good morning, everybody. I know it's been a very long time since we've seen each other in person. I'm Chuck Jackson, the Executive Director. We've got several other staff members with us. We've got Niam Kalong, Craig Fedorovsky, Heather Hessling, Stephanie Kime, Margaret Ward. There may be other folks in the panel and the attendees who are available to answer your questions. But just in case I haven't met you, because I don't get to do morning welcome anymore, that's why I'm. And what I'm going to do is I'm going to run through a fairly short deck. It's just 15 slides. It'll take probably 15 to 20 minutes. And then we're going to open it up for questions, because this is really an opportunity for you to share your thoughts, your concerns, your suggestions, your recommendations, accommodations. Okay. We're going to ask everybody to mute themselves too, if that's all right. And then Craig can unmute you as we get to the Q&As. All right. Thanks, everybody. Appreciate it. And here we go. So we have been talking about how we're going to reopen since we went out back in March of last year. And one thing that's been very consistent has always been the non-negotiables. As we looked at our programming, as we looked at the state of events and the current events and the state of affairs, we realized that we had to be very clear about what our decision-making factors are. So here's what they are. Number one, health and safety is omnipresent. It's the most important thing. We're going to do everything we can to not increase the risk to anybody in our community. That means students, staff, families, our contract workers, everybody who has a piece of CMI. We're going to make sure we do everything we can to keep them safe. The second priority is transparency. This is a hard time. It's confusing. Information is changing on a daily basis. The best way for us to let you know what we're thinking is to tell you and to be very honest about it and to answer questions when they're asked. So transparency has been a big part of this effort as well. Number three, we are focused on meeting the needs of our students, and that's italicized for a reason. We've done a very deep dive into our students, looking at data, everything from attendance, and Nayaka can talk about this even more later, talking about attendance, achievement, assessments, just general observations from our teachers and our directors to understand where our students are the best that we can in this environment. And then looking at those students and figuring out what the needs are and trying to do our reopening plan in a way that meets those needs. Fourth, a lot of schools right out of the gate said early childhood needs to come back right away. That's first and foremost. I want to be clear, at Creative Minds, that has turned out not to be a priority. A lot of schools have struggled with getting early childhood programming out there in a virtual environment. However, our program has great attendance, really good engagement. And in fact, our early childhood educators are teaching other schools how to develop virtual programming that's more engaging. So that's not to say early childhood students won't be invited back. That's to say that just being in early childhood doesn't create an automatic priority. Number five, we're going to start small, and that's what we're going to be talking about today. And we've capped that at 50 students or fewer. The number 50 sort of comes from our analysis of who's available from our staff, thinking about how many students we've identified who have high needs, thinking about what's a good number to truly test our procedures and our policies and to make sure we're following everything and we've got it down pat so we can expand. So that's why number five is start small. And number six, this one's a very important one. We're going to make our decision based on data and science. We're not going to bow to political pressure. You've seen that happen in DC a couple of times where DCPS, because the mayor insisted on reopening, they attempted to reopen and less than 400 kids attended. They're attempted to reopen again. They offered 15,000 slots and less than 9,000 people signed up for them. There's been a lot of push and pull with the unions and groups like that has been distracting from what the kids really need. So political pressure is not the deciding factor here. It truly is, going back to number three, thinking about what our students need, thinking about where we are, and making sure we can address those needs. Those are our 6 critical non-negotiables. So right now, we are monitoring the metrics and guidance for DC, the CDC, Department of Health, educational leaders in the city, the mayor's office, you name it. New things popped up that we're already probably all aware of, but I don't know if folks heard the news on Thursday, but the variants have made it into DC. We're tracking them. Currently in DC, there's 4 reported cases of variances. 3 are the UK variant and 1 is a South African variant. Now that 4 doesn't sound like a big number, but Dr. Nesbitt, who's in charge of the Department of Health, acknowledged that that's just a small sample because they don't test every positive test case for the genetics of the variants. So they've taken a very small sample, and of that small sample, 4 cases have popped up. So she acknowledged that that's probably underreported for DC. Maryland and Virginia basically have the same types of random sampling programs. Maryland has identified 23 cases. Virginia has identified 6 cases of the variances. Some of us probably follow the news, and you've seen where the UK variant in particular in England has caused another national shutdown. It is much more contagious, but it appears to be not quite as dangerous as sort of the original variant. So we're tracking these things. We're trying to stay up to date with all the medical science that we can. Knowing that, we have to be ready to change course on our in-person learning program, no matter how well we plan it out, if the risk shoots up again. So just that's something you're going to hear me say a lot throughout this presentation, because again, we're being transparent. We're trying to be as fair as we can. If there are things that might get in the way, we're going to let you know what they are. COVID-19 testing. We are not requiring negative tests for our staff and our students. Also, we have developed an on-site testing program for our staff, free to all staff and free to all in-person students and their families. And once we get that up and running for our in-person families and students, we're going to open it up to the wider CMI community. We are strongly encouraging people to get tested, but testing currently is not mandated. Negative tests are not mandated for any schools that I'm aware of, at least public schools, both charter and DCPS schools. A couple more things we're looking at right now. COVID-19 vaccinations. Vaccinations have been approved on an emergency basis only at this point. So that means the city and whoever's doling out, the feds, whoever's doling out the doses, have created a priority list, and you've probably heard about that. We've gotten some of our staff onto that priority list. So some of our staff has received the first dose. Additional staff have expressed interest to us that they want to receive the dose and get vaccinated. So as soon as we can, we're going to put them on the eligible list, and we are lobbying hard to expand that list. Bullet point number 3 is kind of important. Charter schools, unlike DCPS, only in-person staff are deemed eligible for vaccines at this stage. All DCPS teachers were given the opportunity, not all opted for it, but for charters, for whatever reason the higher ups thought, only if you had an in-person programming going on could you put people on the list, and it was people who were providing those in-person services. So we were unable to submit all of our staff at that time. We are not requiring staff to be vaccinated to come back into the building. We are also not requiring vaccinated staff to work in the building. We can talk about those reasons in more detail if people have questions, but the bottom line is, even if you're vaccinated, we know that prevents catching the illness and also helps reduce the severity of it. It's unclear, according to the CDC, whether or not it actually prevents spreading. So it's still the potential you could be vaccinated, you could still be a spreader. So we have a lot of staff who may be in multi-generational homes, may have immunocompromised family members, may not be comfortable yet coming in because not enough people have been vaccinated. So we are not mandating that people be vaccinated, that vaccinated staff have to come back to work. Let's talk a little bit about the phases of reopening. So on Tuesday, phase 1 kicks in. Part of a successful reopening is going to be getting staff back into the building. If staff aren't here, we can't bring students back in, obviously. So on February 16th, we've invited staff to come back into the building. Those who are willing, those who are able. And what we're going to do for the folks who show up on the 16th is they're going to be trained on all the protocols. They're going to be able to start doing their teaching and their work from the building if they want. So they could teach their virtual lessons from their classrooms if they'd like to. Part of that is increasing the confidence in the protocols, and also it's to try to move back to some sort of sense of normalcy and to get staff all prepared to handle any kind of thing that might come in once we bring students back. March 1st, what we call creative care is going to begin. These are going to be remote classes taught in the school building. There's going to be no more than 50 students invited back. And it's good for the students who are invited back, they're going to receive in-person support from teaching staff. It's going to be academic support, it's going to be socio-emotional support, and technological support. As I mentioned, we did a deep dive into our students back in the fall. We've done it again at the end of the first semester. We've come up with a list of students where it's just not working. This doesn't mean they don't like virtual. This means they're not showing up to class. There's things going on at home, technology issues. There may be home insecurity, food insecurity. There may be a child taking care of other children so they can't get a log on themselves. Whatever it is, we've identified those students, and those are the ones we're going to bring back first. Depending on how that goes, and again, watching all the other factors I described above, we're going to be looking to expand probably around the 1st of April. Maybe a little bit earlier if things go well, maybe a little bit later, but that's sort of our target date, is that April 1st date. And our goal there is to expand our in-person learning. So the schedule, the start dates, modes of learning, and number of students are all going to depend on many factors. And I just want, again, pure transparency. The number of staff that are willing to come back. Again, if we don't have staff, we can't bring kids back. The public health situation, which we just talked about, and the number of interested families. Let's talk a little bit about what creative care is. Those are going to be those classes that are going to begin March 1st. Students are going to receive that direct academic socio-emotional support from teaching staff as they participate in remote learning. So they'll be still learning from their main lead teachers remotely, but they'll be in person receiving support with that learning, whether it's tutoring, extra exercises. They will participate in recess, they'll be fed, they'll get their bathroom breaks, all that kind of stuff. Socio-emotional support will be there. If there's special ed needs, they'll receive those from folks who are back, if they're back in person. We're going to keep it really small. No more than 10 students in each class, probably less than 10 in each class. The CDC guidelines say in any room, you can't have more than 12 people. So that's 10 students, 2 adults. All the other factors that we'll talk about in a little bit have to be in place: social distancing, masks, et cetera, et cetera. How's it going to work? I talked a little bit about this before. We can answer more questions at the end if need be. Students are chosen on the basis of academic and socio-emotional need. The identified families were contacted last week and earlier this week. So we're coming up with that list. We've pretty much finalized that list now. So when the staff shows up on February 16th for their training to learn the protocols and all that, they'll also be they'll know who's going to be assigned to the rooms, what rooms they'll be assigned to, and all of that. In that April start area, that April 1st start area, expanding our in-person learning program. The goal here is to begin to expand out the program, to bring more students back into the school, to provide those same kind of supports we're talking about with the identified high needs students. The number of students will be based on staff availability and the public health situation. If the CDC guidelines stay in place, we know we can have 12 students in a room, or I'm sorry, 12 people in a room. So those kind of factors are all still going to be in place. But again, if something happens with the variants or something like that, that all may change. So what we're going to do next for you all is the week of March 1st, we're going to send out an email with more details and a form that you're going to fill out for every student at your family, requesting whether or not you want an in-person spot. We're going to ask you to commit to an in-person spot or to commit to virtual. Virtual will be an option throughout the remainder of the year. If you're an in-person person, you can always drop out back into the virtual program if you feel like the risk is too much or something like that. We're not going to be able to bring more students back except by invite. So if you opt for virtual, you're going to be in virtual. What does expanding in-person learning look like? sort of our leading thinking right now, and this is something that we've developed, we started on the summer, developed all through the fall, as we were thinking we would move students back sooner rather than later, is a possibility of 2 staggered cohorts. So cohort A will be in-person learning on Monday and Tuesday. Cohort B is in-person learning on Thursday and Friday. Wednesday, as it is for basically all schools, is remote learning for all students. That's a chance for the building to be deep cleaned. For, in our case, our teachers go into professional development to look at what's working, what's not working, to dive into the student data, all that good stuff. The format is, of course, going to depend on family interests, staff availability, and the health situation. We are intending to offer sibling priorities, though. So if you have multiple students here at Creative Minds and you opt for in-person and we're able to open a slot for one of your siblings or one of your children, we're going to do our best to accommodate families to bring them all back and keep them in the same cohort. So you don't have to bring one child in Monday, Tuesday, and another child in Thursday and Friday. So that's the level of detail that we're getting into as we think about these kinds of things. Let's compare sort of the 4 offerings that I've been talking about here, just so we're clear. I'm sorry, the 3 offerings. All classes, so creative care, expanded learning, in-person learning, and remote, are all going to be the same pace and the same curriculum. So the virtual learning that's happening is either going to happen virtually for all people at home, or it's going to happen for some in school, hopefully more and more in school. And Wednesday is going to be a remote instruction for all students. March 1st, we're going to have up to 10 students in classrooms with a cap of 50. Same remote learning as students at home. Teaching staff will be supporting students in the classrooms. Health conditions, and this, as I warned you in the beginning, health conditions may necessitate that some students, if there is an outbreak or someone displays or tests positive, may have to return to remote learning for a quarantining, something like that. April, again, that's a target date. We're going to keep the same limit of 10 students per class. The schedule, start date, the number of students are all going to depend on the number of available staff. Kind of the thinking behind having 2 cohorts is you can have twice as many students in, right? So you can have half in on the A schedule, half in on the B schedule. That brings more students into the building, yet allows us to control the cohorting, which is the real driving factor there. Again, health conditions may necessitate that we have to step back into virtual learning. Remote learning, as I mentioned, we're not requiring any students to come back. We're not requiring any staff to come back. It is going to remain for the remainder of this school year. Remote learning will be an option. Now we want to talk a little bit about the logistics and safety so you understand why at this point we're feeling more confident that we can start bringing students back into the building. There will be a daily screener. That screening is for COVID-19 symptoms, exposure to people who've had COVID-19, all those kind of things. Those are becoming much more common for people who are going places, so it shouldn't be new to people. We're going to require all visitors to campus, including students, staff, and families, to do the screener before they're allowed into the building. And Heather has links online so she can answer specific questions of what the logistics of that will be. But basically, it's going to be an app that can be on your phone. You'll answer the questions, and depending on the answer to your questions, you'll be screened to come into the building, or you'll be told to not come into the building. All visits, everybody's going to be required to sign in when you get here. That's what we mean by recorded. So we can do the cohorting. So we can do, the tracking and tracing. If there is an outbreak, if there is someone displaying symptoms or a positive test, we will know who's in the building at what time and who they're with. And so then we don't have to shut everything down. We can focus on the folks impacted. An example of something like that just happened in San Diego, for example, they just reopened. 7 kids brought COVID in to the schools. The school didn't spread it, but 7 kids brought it in. 100 people were impacted. 100 people had to quarantine per CDC guidelines, and they had to shut down some of the schools. So that's sort of what we're trying to avoid and trying to minimize the impact. PPE, personal protective equipment, is going to be required for everyone in the building and on campus, 2 years old or older. Learning at school, social distancing. Classrooms, meals, moving throughout the building are all going to be tightly controlled. We're going to make sure kids stay 6 feet apart in the classrooms. Desks will be set up facing the right direction. We've got extremely detailed descriptions that we're going to teach all of our staff on how to do this, how to lay out the cots for the early childhood kids, for example. So all of that has already been thought through and planned and will be enforced. Restrictions, contact among cohorts is going to be minimized. There's going to be no in-person before school and after school programming, just so we're clear, because that makes our cohorts a complete mess. Students' personal belongings, we're going to ask people to keep as many as they can at home. Only bring the necessities to school. Meals are going to be staggered and they're going to be in the classroom. Kids are not going to be down in the cafeteria, in the great hall, eating together, again, trying to control those cohorts. More logistics and safety. Cleaning, disinfection. Throughout the day, teachers and our cleaning staff and our administrators are going to be disinfecting high contact surfaces. The staff has been, or at least the cleaning staff has been in here. They have cleaned every inch of this building, all the way up to the ceilings, the walls, everything. But we are going to, for all high contact surfaces, doorknobs, sinks, whatever, desks, those are going to be wiped down regularly throughout the day. Disinfect daily. That's going to happen in the evenings when students aren't here. There's all classrooms are going to be disinfected, including our early childhood cots. Disinfected weekly. What we mean by this is the entire building is going to get electrostatic spraying. That's a really good way to sort of spray out. It's like spraying Lysol over the entire building. They come in, they're in their space suits, and they walk around the building. They literally spray every surface. It rests over the weekend, kills the germs. So when we come back on Monday, hopefully it's very clean. These match or exceed hospital standards. So we're clear. Heather's been doing an amazing job working with the Office of the State Superintendent and Department of Health folks to make sure we're doing as much as we can to be safe. If someone is diagnosed with COVID-19 or one of its variants in the community, we have very clear guidelines and protocols from the Office of the State Superintendent and from the Department of Health of what to follow. Those can be dropped in the chat to the extent, I think we have a flow chart. If not, we can make it available. Heather can answer specific questions today if you have them, but that has all been thought through and planned through and been run through already by the health officials. Air filtration is another area folks talk a lot about when we're talking about safety. We've hired a group called SETI and Associates, who are sort of the national experts. DCPS, colleges throughout the nation, other large institutions use them to study airflow and air purification and quality airflow in buildings. So they're sort of the leading experts. They've already come into our building and done a study. They've made some short-term recommendations and some long-term recommendations for us. One of the main short-term recommendations that we have already put in place is in each and every classroom, in every office, there's a HEPA UVC filter machine. What this machine does is it literally cycles the air in the room 6 times through this filter. It blasts it with, it's a very fine filter, so it takes out particles and water particles, but it also blasts everything with UV light. So we're told that kills 99% of the germs. That's one of the best things we can do in the buildings to ensure whatever particulates are in the air get filtered out. Now, again, in trying to be honest in all cases, we want to talk about some of the challenges. It's great to make plans, but sometimes you have to adjust. So here's some of the things that we're keeping in mind as we push towards that April 1 target date for expanding our in-person learning. We may not have a spot for every single student or family who wants one. Again, that's going to be driven by social distancing guidelines. It's going to be driven by available staff. All of those kind of things need to be taken into impact. We are going to ask everybody, and we'll put it on the list. If you are offered in person, a student may need to change classes. What we mean by that is you might not be cohorted with your original class. If not everybody in your original class decides they want to come back or we can't accommodate them, we have to merge a couple, say, second grade classes together. You might be in that group. You will still be doing the same virtual learning with the same lead teachers. But one of the things that Nyamka's talked about, which I thought was a brilliant idea that the academic team had here, is get our kids to know everybody at their grade level. So when we are able to bring students back, they're familiar with all the teachers at their grade level. We may have to offer spots via a lottery, and there may be some preferences built into that lottery given our priority populations. Some of the examples we talked about already, students who have not been able to engage, special ed students, English language learners are some examples that come to mind. Now, some classes or some grades may have teachers who can only work remotely, so we may not be able to bring students back there. Again, it's trying to be transparent. If all of our second grade teachers say they're not able to come back for whatever reason or not willing to, we may not be able to bring second graders back. That's just an example. It's not saying our second grade teachers have said that, but it's just an example. So we may have to shift teachers from one class to another. Again, that's why we've tried to get kids to know a lot of people in the building. And there's a possibility that entire classes may have to stay remote. Good news, after all that, I wouldn't say bad news. I actually think it's really great news that we're going to bring some kids back. But in all of these efforts to talk to our kids in particular, and our families and our staff, there's been a loud hue and cry for more social time, especially from our student government. I had a great time talking to our student government a couple weeks back, and we'll be sharing sort of some highlights from that interview. But one of the things that came clear in that interview, in the conversation, was they can do the virtual learning, but they want to just hang with their friends, even if it's virtually. They want to do fun things with their friends. So they asked us, they charged us with, could you create some more opportunities? So our aftercare staff have begun planning some really interesting, fun things that we're going to be able to make available very soon. So that what we're visualizing are opportunities for kids to socialize around organized activities, supervised organized activities, 30-minute sessions live on Mondays, Tuesdays, and Thursdays, not on Wednesdays because of PD, and Fridays just because we're going to take Fridays off with respect to that. Sessions are going to be limited, so it's not 100 kids, it's going to be limited up to 20 kids based on their interest level and those kind of things. And our goal is to change the activities every 30 to 45 days so students can do more than one activity. They can have some fun, they can expand their horizons, see other kids. So here are some examples of what the programming we think is going to be. And again, it's in development right now. Art programming, some fitness programming. Our PE classes have had some of the best attendance rates because it's a lot of fun. Spanish language, cooking, as we've done in the past and has always been a big hit. We're looking at doing some facilitated peer circles as part of some socio-emotional support for our middle school kids, because middle school is a big time of transition. And it's a chance when it's a lot of what happens in middle school are kids become more individualized, but yet they affiliate more with groups. And so it's a chance for kids to work through some of that stuff, some of that growth, some of that maturity together, but facilitated. There's going to be some activity cohorts. So here's what we're envisioning. So you get a sense of who they'll be grouped with if you sign up for this. Early childhood education, again, activities specifically designed around that level. Grades 1 through 4 and grades 5 through 8. Next reopening update is due March 1st. That will be a couple weeks after staff is back in place, after we've run through our protocols, after we get a really strong sense of what staff are willing to come back, give more staff a chance to get vaccinated. We'll be able to find out who our family members are and who wants to come back. So what we're going to send out are details about schedules, modes of learning, logistics, other topics, so you can make a very informed decision based on how it's gone for whether or not you want to join us in expanded learning in April. There will be a form attached to the communication that goes out where you can request a spot for expanded in-person learning. Once we get that, we'll see who's interested, we'll line it up with our staff, and we'll begin inviting folks back. And with that, I think I've covered everything. Sorry I did all the talking. I normally hate doing that, but we thought it was really important to get this information out there. And now what we're going to do is I'm going to stop sharing my screen so I can look at the chat. We're going to turn it over to Craig, who will start directing questions to the right folks. Okay? Thank you all for your attention.
All right, thanks, Chuck. There are a few questions that I'll kind of group and start to hand out. But if you do have questions or comments, please do put them in the chat, remembering to send it to all panelists and attendees so that everyone can see the question. And if someone has the same question, then we don't have to duplicate. So with that, Nyamka, you are first up on Q&A with CMI. Can you revisit or talk to who will be teaching the child's in-person class if their main teacher is teaching virtually, and just kind of go over the logistics of how that will work again quickly?
Sure. So for the first group that we're bringing back in March, we have identified either teaching assistants or dedicated aides who are going to be supporting those classes for the creative cares. And so that those teachers will be able to help the students get on. There's a chance that we may have some of our lead teachers participate in that, but we are going to develop the schedule so that they'll still be able to continue to do their lessons as they typically have done since we've been in this virtual space. So the teachers who are in those creative cares classrooms starting in March, they're going to be responsible for helping students get onto their devices. If there's any, making sure they have the materials they need for the day. They're also going to be, after the lesson's done, if they have questions, those adults, teachers will be there to support them with their learning.
Great, thank you for that, Nyamka. Next question is, for the AB model that we may implement, is it going to be a max of 2 days in person and 3 days at home, or what are the options for that being considered?
Sure. So that's going to be contingent upon how many students request to come back. Our goal is really to maximize the amount of time that we can have students into the building. So if we can, have, 300 students in the building, and we have, maybe 600 who say they want to come in, we could do half one day, half another day. However, if we have fewer students, then we may be able to increase the opportunity for them to come back. So that's really going to be contingent on the number of students who we have interested in coming back, as well as the staff. But there's certain guidelines that we have to have a max number of students that we can have in the building to ensure that we're meeting those social distance requirements.
Great, thank you. And one more for you right now, if you can talk a little bit about our thinking around outdoor learning and possibly outdoor meals. And Heather, if you want to chime in after Nyamka, kind of with any more context on the outdoor meals or how meals are being approached, that would be useful.
Sure. That was one thing that we heard from our staff as well. Like, how does lunch work? I think they felt comfortable with students having the mask on, but what does that look like when they don't have them on and have to eat? Our goal is to have as many meals, or when students have to take those masks off, outside as possible. In March, it could be very tricky on what the weather is going to look like, as we have, this drizzling rain right now. But we'd hope that we could have those as many opportunities outside as possible. Like the recess we want to have outside. Those are those kind of structured times that are not when students are logged into their virtual classes. We want to have students outside as possible. However, when they're in the classroom and are required, we're going to ensure that there is distance between students. There's a short time that we're going to eat, and then our mask back on, and then hand washing and clean down the surfaces, because we really want to mitigate any opportunity for those germs to be spread. And I'll turn it over to Heather to add additional thoughts there.
Hi, good morning. So with regard to meal service, if you have two options for food, let's start here. You can either bring your meals from home, or you can participate in our school lunch program. Our vendor is a new vendor called Top Spanish, who's going to do the catering. Lunches will be available, and breakfast as well, at a cost of $0.00 for all students. So school lunch will be free this year for everybody. How it will work is that for the most part, we are really trying to minimize the interaction of cohorts, even with the staff. So like the food will be dropped off outside the door, and then the cohort teachers will either bring it in the door or take it outside so that the kids can eat. We have a very clear protocol of things that you need to do before you eat, like disinfect the desk, wash your hands, have the food, take your mask off. The mask will be stored in a bag while they're eating, like a plastic bag. Each student will have their own plastic bag. And then they'll put the mask back on when they're done eating, wash their hands. All the trash will go in the hallway, or if they're outside, it will go in the trash cans outside. A couple of logistics for everyone on campus: if we're able to offer opportunities to eat outside, we have to be very cognizant of picking up our trash. I know that sounds crazy, but the Armed Forces Retirement Home has lots of rules and lots of standards that we need to comply with, especially when we're outside, and the trash is one of them that they've constantly complained about for years. But we are working with them to set up spaces where classes can go outside, possibly to have lunch, or if the weather is nice, to go outside to do a lesson. We are still working out all the details, but we are definitely trending and trying to support this from a logistics side. How it works with the classrooms and the schedules, that's the academic side.
Okay, thanks, Heather. And I'm going to go back to Nyamka, as we've had one or two questions pop up again around how teacher coverage is going to work If some teachers continue to teach remotely, who will be covering the in-person classroom and kind of what the approach is there. So Nayaka, if you maybe want to revisit that again a little bit, we can try and make sure folks are getting their questions answered.
Sure, sure. So with that March, I'll go back to kind of March and then how we see that transitioning to April. So with March, we have identified some teaching assistants and some dedicated aides who are willing to come back. So they're going to kind of be our primary teachers in those classrooms for March. So also in March, we're also going to be having some of our lead teachers come back. They are not going to be in those kind of creative cares classrooms. They may be teaching their virtual lesson in another classroom down the hall or on a different floor. And so they'll continue to, be able to support their classes. As we kind of transition to April, when we have more students come into the building, what that may look like is that, the lead teachers who we have in the building, during those times when they don't have lessons happening, either in that virtual space, they may be covering a different class, or they may have students in their care during that time. It's definitely going to be some like cohorting where these set teachers are with these set teachers, and those teachers may be transitioning in and out of the classroom to support their virtual lesson. Like I said, there's a lot of kind of moving pieces to make that happen, but we found that the schedule is working really well for most of our students. And really what we're trying to do in this April timeframe is to really bring more students back in, but really keep those routines and things that seem to be working really well for most families intact. And so that's our goal. We might have to make some minor tweaks to what that looks like. For example, going back to what Chuck mentioned, if maybe none of our lead second grade teachers feel comfortable coming back in, we may have like a teaching assistant from a different grade level in supporting those students, but then they would still be getting that instruction from their second grade teachers. So a lot of different variables and things happening. And we really, by starting small, hope that we can kind of sort all those things out and think through many different options. And also hearing from our families will really give us some insight on how we do that programming.
Okay, great, thanks. On one more reminder, if you do have questions, because we have about 2 or 3 more left to answer. So if you do have questions that you want answered, please do put them in the chat so that we can get to those. Chuck, I'm going to come over to you for thoughts or comments on, and as well as Nyamka, on summer learning and what our thoughts are for after the school year in June.
Great, thanks. It's a question a lot of educational leaders in the city are trying to figure out right now. So it's the easiest and safest answer is to say there isn't a hard plan right now about summer programming. Some schools are considering expanding their school year, extending it. Some are talking about creating tutoring programs. Many of them are in a situation similar to Creative Minds, where their teachers are 10-month employees and they get the summer off. So you'd have to address what that employment relationship looks like. And if you're bringing people back in the summer or keeping them longer in the summer, how do you manage those kind of things? The other thing that I think is critically important, though, and one of the reasons why we're pushing now for as much in-person learning as we can do, is to understand where our kids are. We haven't seen them and been in person with them in a long time. Yes, we're assessing, but I think we'll have a much better idea of where kids are and if there needs to be a focus on socio-emotional learning, trauma-informed practice, or just pure academic remedial work, whatever it might be. The more kids we get back in person, the more staff we get back in person to understand what effective summer programming might look like. I think the thing for us to understand, though, is this plan we're presenting today is through the end of this academic school year. We are planning now, believe it or not, we're planning the rest of the school year and we're planning next school year at the same time. We are cautiously optimistic that in the fall of next year, we should be able to reopen as Creative Minds used to be. Better, hopefully, but with in-person instruction with all of our teachers, or the vast majority of our teachers in person. So long as we continue doing 1 million, I think yesterday we did 1.8 million vaccinations. We stay on pace with that. The Biden administration just secured another 200 million doses available, which should be available sometime early summer-ish, late spring. More people can get vaccinated. We can move to that magical 75% vaccinated number where we feel like we can return to all in-person behaviors. We're hopeful, and we're listening to the experts here, that we'll be able to get there by beginning of next school year. I know that wasn't asked, but I think it's important for folks to understand we're looking that far forward. We are going to be building our schedules. We're going to be recruiting kids as though we're going to be back in person. We're going to be building our budget and all of our programming and protocols as though we're back in person in the fall.
Great, thanks, Chuck. I'll tackle one question that I did answer in the chat, but so that folks aren't online and listening in over the phone. Is 50 students the max for creative care or April? That is the target max number for the creative care model. The April number will kind of be a dance. We'll have to see how many staff we have available and able to come back and what demand is for families, and would reference folks back to the point in the deck where Chuck indicated we may not have enough staff available to cover everyone that wants to be in person. And we may need to go to a lottery model if we have more family demand than we have staff available. So that's kind of what we're going to have to piece together after the questionnaire goes out and families are asked to make a survey, and we do another round of inquiry with our staff to confirm who is able to come back or willing to come back and teach in person. Nayam, I'm going to come back to you for a question from Ryan, who asked for a little more clarification on the April model and clarifying, is it really just virtual learning in person, or is it direct instruction? So if you want to address that one, that would be useful again, please.
Sure. So with the current schedule that we have, we want to keep that intact. So that would continue to remain the virtual. The gaps and things that are in that original schedule will be opportunities for us to have kind of more in person. So that may be when they have their recess where they're working on like social emotional things outside, or, you know, during other times in the day, there may be like read aloud opportunities to do some sort of engaging games. It could be opportunities to work on addition lessons. So there will be some of that in-person instruction happening outside of that kind of structured time that they already have for that virtual learning. Does that answer the question, Ryan?
Okay, we'll see if Ryan has a follow-on for that. We are down to one question left, which I'll pitch over to Chuck in just a second. So we are at around 10:45. We have 15 more minutes scheduled for this. So if you do have additional questions, I'll kind of say last call at this point to get them in, and we certainly want to address them. So if you do have something that wasn't answered, please put it out there. And so Chuck, over to you. There was a question on the ability to use the playground.
Yeah, great. It's a good question. So the playground is on the Armed Forces Retirement Homes campus, right? They have, as Heather mentioned earlier, they have a fair number of rules and restrictions. So for example, you're not allowed to go to Lincoln's Cottage unless you have a specific appointment for a specific outdoor tour. You're not allowed to go to Creative Minds unless you're a student or have one of the passes, or your family member, or we put you on the list. They're being very careful about controlling who comes in and who doesn't. So that is one part of the process in order to create more access to the playground, is working with them to understand what their expectations are, to what extent it can be made available to the community, things like that. The other thing to note, though, is when we're in person, the students who are in Creative Minds are going to be using the playground for recess again. And so we have to be cautious about having folks from the outside coming in and potentially, it's a terrible word, but contaminating the kids who are already in our safe sort of bubble here at Creative Minds. So that's another factor that we look at. So if I were to envision some possibility of it being available, would be probably after school hours, potentially on the weekend. But again, that comes down to the Armed Forces Retirement Home, the guards at the gate, and their safety protocols. And I hope that answers the question.
Okay, thanks, Chuck. Yep, we do have an affirmative from Ryan that you did answer his question. I do not have any other questions currently in queue. So we'll say kind of going once, going twice here. Last opportunity to throw something in the chat if you do want something that's not answered yet to be answered.
While we're waiting for
Think of something. Oh, sorry, Nayaka.
I think we're going to say the same thing.
Probably.
I think
You go first.
super helpful to kind of hear from our community around like their thoughts about coming back, because we do take that into consideration, as well as our teachers and our students. And we really are trying to be thoughtful around how to make the most of this situation that we've kind of been handed. And I feel like we've done a good job, but we feel like we're always looking to be reflective in our approach and really value the input that our community provides. So we really appreciate you showing up this morning. And if you have questions, we appreciate the questions because we want to be able to be transparent and share as much information with you as we can.
Great, thanks, Amka. We do have a couple questions trickling in. Heather, I'll ask you to unmute and kind of address again the process and protocol for what will happen if there is a positive case or exposure in one of the classrooms.
Great. So I saw the question in the chat. It asked if we are going to follow DCPS's protocol. The answer is probably no. However, it'll be very similar because we are going to follow OSCE's and DC Health guidelines. If you would like, our protocols, we actually wrote them and posted them on our website back in June, July, kind of the outline of what it would look like. There is a lovely document called the Reopening and Recovery, which is 100 pages of fun. Okay, I'm not recommend you actually read it, but the protocols are detailed in there. And we are also working on outlining them with the staff. If we have a positive case, it depends on how the positive case is identified and found. For example, if people who are in-person learning, similar to DCPS, the school nurse will, if parents opt in, will be able to do COVID testing for children who become sick during the school day, who pass the screener in the morning and then become sick. So let's say if we did that and the test is positive, then we would implement our procedure right then and there for the student who would have to leave, and then also the entire cohort would be excluded as per the OSCE's and DC Health guidelines, and then the building would be cleaned with the electrostatic spraying and our process that we have internally, which is a little more comprehensive than the minimum guidelines that were put out by DC Health. If, for example, somebody reports that they were sick, we will implement our policies. Our policies are clearly written. We are also working to make sure that we have clear communications ready to go. So anybody that's in the cohort, please be noted that we will never identify the person in the cohort who tested positive, whether that's me or if that's a student. We will keep their names out of it, but we will share with the information with the cohort immediately. And then within the next few hours, we will share with the community at large. Again, we are really striving for transparency while maintaining all the compliance with FERPA and HIPAA laws, depending on if it's a child or a staff member. So hopefully that answers your question.
Great, thanks Heather for the detailed response. There was a question on how many staff have been vaccinated, and I'll take a stab, and then Chuck, if you want to chime in with additional context. The way vaccinations have worked is several weeks ago, we were able to submit on a very short turnaround time a list of staff that were working from the building or supporting some of the in-person services we are providing. That was a limited number of staff. That has been the only opportunity so far that charter schools have had to submit names that would be eligible to start into the vaccination process. So it is a fairly small number in comparison to our overall staff size. And as Chuck referenced earlier, we are awaiting guidance and lobbying heavily kind of on the behind the scenes to try to get that process moving. The challenge is really one of a supply challenge for the district right now, in that one of the briefings we received from the deputy mayor was that the total number of DC folks, and remember, these can also be folks that don't live in DC, as they are vaccinating folks that work in the district, such as healthcare workers that may live outside of DC, was around 300,000 folks between frontline emergency medical personnel, firefighters, emergency services folks, DC public school teachers, charter school teachers, and that we are waiting on there's only about 8,000 doses coming into the district a week at any given time right now. So it is a process that we're waiting on more guidance on, and certainly ready to submit more names and move them into the program as soon as we can. Chuck, anything to add to that?
No, I would just say, I can't give the exact percentage of staff that were on the first eligible list for Creative Minds, but it was well over 90%, as I recall. We had a list, and I think only 2 people on the list hadn't yet, and this was maybe a week ago, made their first appointment. Since then, they may have already made their first appointments. Most of us who have already gotten our first vaccination will be getting our second vaccination next week. That's in our 21-day period. I know mine is Wednesday morning. So Craig is 100% right. The demand far exceeds the available supply. And the other really good factor that I just want to highlight that Craig called out, but it's something that a lot of other people forget about, is because DC, most people who work in DC live outside of DC. And if you're an essential worker here, so they're not just vaccinating DC residents, but all essential workers who are eligible could live in Maryland, they could live in Pennsylvania, they could live in Virginia, it doesn't matter. They can get vaccinated in DC. So that also sort of reduces the amount of doses available for DC residents. So it's a moving target, but we are, on our end, two things we're doing. We are encouraging all of our staff, anybody who wants to come back, to get it vaccinated in any way they can, whether it's in their home state. We'll push to put them on the list the next time, and we are lobbying almost on a daily basis to try to get that list expanded. And that's the second one, is we are working with the city leaders and the educational authorities and those folks to explain that folks will be willing to come back to work if they can get vaccinated, versus saying you have to be back at work in order to get vaccinated. It's sort of a cart is before the horse a little bit. And so we're trying to help them understand that's what one of the factors that is slowing down the reopening. So.
Okay, thanks, Chuck. Last question I currently have is a little more on SETI's recommendations for improving the air quality in the building. As Heather mentioned, we had them come in. We did and have implemented a lot of the kind of low-hanging fruit, if you will, or things that were easy for us to implement. There are a few more complex and, to be honest, quite a lot more costly recommendations that they made that we are looking at, one of which is enabling the windows to actually open in some of the classrooms. That is quite complex in that they are historic windows, they are sealed shut. A lot of them are quite old and the frame may need particular work. So that is a big challenge for us around the windows. The other that we have them actively looking at is a design for a dedicated outdoor air system, or a DOAS, for those that are more familiar with the engineering, which would involve drafting or dropping some units up in our attic space. However, that is a very large project, to say the least, given the nature of the building, and that would require new ductwork to be run throughout the building, a lot of new electrical to be dropped into the building, historic implications as far as where those DOAS would reside. If they're on the roof, there's historic review that has to take place as far as sight lines. But we are looking at that and awaiting a proposal for them to kind of see the price tag and be able to go from there. So we are looking at what the options are. We are looking at our opportunities from grant money that's available, from our cash position that we have available, as far as what we might be able to implement between now and the start of next school year. I will be honest that both of those projects would likely not take place until at the earliest over the summer, given the work that would need to be done in the building for that. So that's the earliest that it would probably start, but we will keep you posted. And once we get a little more definitive information on what the price tag associated with those are, then we'll be able to kind of see what we can do short term and what will have to be a longer term issues. Okay, I don't see any other questions. All right, well, Chuck or Nayaka, if you want to kind of wrap us up then and finish us out.
Sure, thanks. So thank you all so very much for everything, quite frankly, for giving us some time on Saturday, in particular to your very thoughtful questions, your recommendations. We always take something from every one of these conversations. We always learn from you as much as we hope your kids learn with us. So thank you. Craig's getting some backup here. We bring everybody in to help us do this right, so we're clear, right? We get knowledge from everybody. But I do also want to thank you for trusting us with your kids. They are the most precious things to you and to us, and this is why we all do this. Our number one motivator is to get the kids back in the school. We want to do it safely. We want to get them back so it's a healthy, happy, process where we build these beautiful human beings. That is why we do this. So thank you for trusting us with that mission, but also, we appreciate the grace you've shown us because it is a very hard and very complicated process. Again, if you have any questions at any time, you can email us, you can ask, you can call. Some of us are in the building all the time, so feel free to reach out. And thank you again. Have a lovely, lovely weekend.
Bye-bye. Thank you.
Thank you, everyone. Bye now.